It's hard for many to wrap their brains around the idea that anything might be back to business as usual by the president's target date of May 1st. That's just 4 days after the peak here in Massachusetts, as predicted by the White House-cited IHME model. And on the day of May 1st itself, according to that model, 196 deaths are expected here. So it's no surprise Governor Charlie Baker is not exactly rushing to reopen things. But that's not his decision, according to the president. As Trump tweeted this morning, quote, some in the fake news media are saying that it's the governor's decision to open up the states, not that of the president of the United States and the federal government. Let it be fully understood that this is incorrect. It is the decision of the president, and for many good reasons. A decision by me, in conjunction with the governors and input from others, will be made shortly. This afternoon, New York Governor Andrew Cuomo announced a partnership with 6 other Northeast states, including Massachusetts, who'll be working together on when and how to reopen. But it's not just the governors the president's looking to show dominance over these days. Last night, he retweeted a conservative's calling to hashtag fire Fauci, referring to key White House coronavirus task force Dr. Anthony Fauci, who said this to CNN's Jake Tapper earlier in the day.
You could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated. But you're right. I mean, obviously, if we had right from the very beginning shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
Once again, I'm going to have to go with the doctor on this one, along with the head of the CDC, who said today he suggested social distancing measures back in February. But back to what's ahead in this state. If you've been keeping track at all, you know that anticipated peak date has been moving later and later, which is in part a good thing, because it means we're flattening the proverbial curve. But with the model, and as the governor says, it is just a model, anticipating we'll be short more than 3,200 hospital beds, there's still plenty to be concerned about in the days and weeks ahead. That's exactly why the state issued guidelines last week about who should get preference if hospitals have to start rationing care. But now a group of about 350 doctors, nurses, and others has signed an open letter to state officials arguing those guidelines will further hurt members of the community who are already marginalized, such as communities of color, refugees, and those experiencing poverty or living with disabilities. My next guest goes even a step further. She's calling for a ventilator lottery system across the U.S. I'm joined now by Dr. Michelle Holmes of Brigham and Women's Hospital. She also teaches at Harvard Medical School and the Harvard School of Public Health. Dr. Holmes, it's good to see you. Thanks so much for being here.
My pleasure.
The other night, Dr. Trug from Harvard, who was one of the people on the group that came up with these guidelines, was with me. And I asked him if including the likelihood of survival and length of survival after didn't bake in racial and socioeconomic bias. He said no, it did not. And then today, the Secretary of Health and Human Services, Mary Lou Sudders, had this to say.
It's important to reiterate that these guidelines are voluntary. And at their core is to mitigate against unconscious bias in making critical medical decisions during a pandemic or crisis where there are scant medical resources.
So, Doctor, where are they both wrong?
Yeah, I think what I want to say is that my colleagues who've designed these systems are really doing the best they can in truly trying times. However, I'm troubled by the notion that kind of fancying up the rationing system with points somehow protects and absolves us from our own implicit biases. And so that's why I'm advocating a lottery system. It's more truly objective.
I want to get to the lottery in just a second, but as you know, in those guidelines, in addition to the criteria that I mentioned, there's also language that says that things like immigration status, race, socioeconomic status, on and on, incarceration status, shall not be relevant, shall not be considered. That doesn't satisfy your concerns either, apparently, correct?
No. Promoters of this system like to say that it's fair because it doesn't have these, categorical exclusions. But that's, I think, naive because poor health is a proxy for race, for poverty, for immigration status.
So can we step back for a second before we get to this lottery notion of yours? There's certain things that are beyond dispute. namely that a disproportionate number of people of color are not only getting coronavirus, but dying from it. Let me just share some statistics with the people at home. In Boston, for example, African Americans are 23% of the population, yet 40%, almost double the number of diagnosed cases. Just picking one state, Michigan, African Americans, 14% of the population, 2.5 times as many diagnosed cases, and 3 times as many, 40% of the deaths. There is no short-term solution to that problem, correct?
Yes, and I believe it's caused by numerous things. It's caused by a history of systemic racism that has allowed people of color to be exposed to toxic pollution, residential pollution, to be targeted by soda companies and junk food companies, and to live in food deserts, to have poor access to healthcare. It's also because a number of essential workers, such as bus drivers, sanitation workers, farm workers, grocery store clerks, are majority people of color, and they do not have the same access to protection that even healthcare workers have.
And again, a lot of that predates, in fact, all of that predates coronavirus. That's the inequity that has been in the system for a long time. Can we get back to your idea about a lottery? How would that work? Literally, everybody gets thrown into a pile and whoever gets picked gets picked?
First of all, I do not advocate using intensive treatments on people who cannot possibly survive them, whether in a time of scarcity or not. As a physician, I know that, and I know that there is subjectivity in making that decision about not possibly benefiting from intensive treatment. Secondly, I'm also not advocating using a lottery to put people on ventilators against their will. My own parents, who died in the past year at an advanced age, were very clear that they did not want that kind of invasive treatment, and I made sure that they died peacefully on hospice care without it. Mm-hmm. Thirdly, I actually find the idea of a lottery kind of horrifying. And again, I said my colleagues are doing the best they can, but we are struggling for some kind of objectivity. And I propose that the point systems cannot rid ourselves of the implicit biases and histories of systemic injustices. After excluding patients who cannot survive and who don't want that kind of treatment, I propose a lottery would give us the true objectivity that we seek.
Okay,
now,
so
my hope is that we would never use it, but it would spur us to even greater innovation than is being the heroic efforts that are going on now.
Well, I'm assuming everybody agrees with you that they hope we don't use it, but let's assume we have to for a moment. I'm guessing that nobody would disagree with your notion that if you don't want, obviously, to get a ventilator, you don't get it. But when you say people who clearly will not survive, there's a 77-year-old man who has a heart condition, but other than that, he's doing fine. Should he be in the lottery with a 25-year-old parent of 3 young kids?
Well, you know, it's interesting that you bring up the age business because prioritizing younger over older people is widely accepted. Mm-hmm. However, I think that should be examined as a cultural value. Ageism is said to be the last acceptable form of prejudice. And at one point in our history, there was broad consensus that white people should ride in the front of the bus and that men should have priority over women in medical school. So I think we need to examine. Everyone knew that until one day we didn't. And to quote a trite example, why is the term "okay, boomer" considered funny, but it's not acceptable to make fun of people's ethnicity or disability status?
But are you equating considering someone's age, particularly if it's an older age, the same as considering someone's skin color?
It's not. We can't equate it in a linear way. I'm saying that in the society we live in, people of color are considered marginalized, and older people are too. And we have to figure that in.
So one last thing about this lottery notion, if I may, is it the only place this afternoon that I could ever see a lottery being used in a situation like this is in a system you don't like, a point system in New York, actually, a few years ago. Didn't have to be used, but it was proposed in a point system where there was a tie. And what would break the tie was a lottery. Other than that, has a system like you're describing, Doctor, ever been used in a similar circumstance?
Not to my notion. Not
What's
to
that?
my notion. By the way, most of the systems have points assigned to them.
Mm-hmm. So let's step back and talk about those larger inequities that we discussed a minute ago that pre-existed coronavirus. Are you amongst those who thinks that one of the hopeful things out of this nightmare that we've been living through and will continue to live through for a while is that that issue will be higher profile even after a coronavirus? Or is this its moment and it's going to disappear like it's disappeared from much public debate in the past?
I hope not. I mean, the more we talk about it, I hopefully that this is a moment that allows us to bring that debate to the forefront.
One last thing for me. I know one of the areas you've spent a lot of your career is working with breast cancer people. Are those with breast cancer and other conditions that are not coronavirus getting pushed to the back of the line in dangerous ways, not intentionally, but getting pushed to the back of the line because of this laser-like focus on COVID-19?
Well, I understand people of every kind of care not getting, the care they need right now. I mean, one of the concerns I know that many physicians have is that people with things like high blood pressure and diabetes, you can't go to your doctor right now. You can have a telehealth appointment, but there are things like there are fewer heart attacks recently. Why is that? How can that be just because we're physically isolating? Are people having heart attacks silently at home? So, yes, I'm concerned, of course, in a system where we're dealing with a massive crisis, that people with other chronic conditions are not getting the care that they need.
Dr. Michelle Holmes, I really appreciate your time and your thoughts. Thanks so much for being with me.
Thank you. Thank you for having me.
Appreciate it. And if you want to learn more about her petition, you can find it at change.org/justrationing.